Welcome to Talk Tuesday. I'm your host, Kendra Cook. This is a live call-in show Tuesday at 5:30 and then rebroadcast throughout the week also at 5:30 p.m. before the DCTV News at Noon evening replay. If you'd like to call in, the number is 677-4119. Today's guest is Amber Anderson, who works with the health clinic and has an upcoming event she'd like to invite you all to. And that's what we're going to talk about tonight. Amber, thanks for coming. Could you tell us a little bit about your position at the health clinic?
Hi, I'm Amber Henderson, and I am a patient navigator and a certified application counselor at the community health clinic here in town. My job is basically to help people to get signed up for health insurance, whether it's Medicaid, Medicare, or marketplace insurance. And my job as a patient navigator, I help people find financial resources for treatments that they need.
That is very important. And so basically coming up, what you wanted to promote is that we have a town hall meeting on November 2nd?
November 1st.
November 1st, 5 to 7 p.m. at the community center. And that's going to help a lot of people to understand if they want to come and listen to some experts. Can you tell us a little bit about it?
I can. We're really excited because we have experts coming from many different agencies. We have Sylvia Johnson from Dolores County Department of Human Services, and she's going to talk about Medicaid and CHP Plus, which is the Children's Health Plan Plus. We have Mary Gannier is coming from the Pinion Project, and she's going to be talking a little bit about long-term Medicaid and what it involves and who might be eligible for that. We have Nita Perkett coming from the Senior Center. She's going to talk about the changes that are coming in the supplements for Medicare and in the changes to the Part D plans that are coming. And then we have Linda Gann from Connect for Health Colorado, and she's going to be coming to talk to us about the changes that are happening in the marketplace and how they're going to affect Coloradans.
So this is really open to all ranges of ages.
Oh yes, we would like everybody to come.
Not just for the older population.
Not just for the older population.
That's great. And you expect it to be a couple of hours, and people could also ask questions at the end? Is that
the way that we're hoping it will work is the panelists will talk about their programs, and then we'll have a few minutes for questions for each panelist. And then at the end, we'll have time for questions as well. And I would really like to encourage people, even if you can't be there for the full time, please come. Because even if the program that you're interested in or that you need information about has already spoken, we will be taking questions at the end to answer any leftover questions.
So it's okay if you work till 5 and you can't quite get there.
You can't quite get there. And we are trying to slate it so that the marketplace, so that Linda Gann speaks last, so that problem, because we are afraid that will be a problem.
And so let's, one thing that we need to talk about is the open enrollment period that's happening right now. And you are the patient navigator, so that is something that you are very well versed on.
Actually, that part is my certified application counselor job. And the open enrollment for Connect for Health starts November 1st. And Colorado is lucky because we actually are getting a longer open enrollment than the feds are. Federal open enrollment runs from November 1st to December 15th. We have extended ours to January 12th in order to make sure that we can get as many people signed up as possible. But December 15th is the last day to get signed up for your coverage to start on January 1st.
And this is coverage for anybody that doesn't have a plan with their company? Or
if you don't have a plan with your company, if you can't afford to purchase private health care. And there are some other things that come in. If you have a plan through your company, but it costs you more than 8.5% of your annual income, then it's considered unaffordable, and you can go on the marketplace and purchase health coverage with advanced premium tax credits. Now, the advanced premium tax credit is money that the government gives directly to the insurance company to lower your costs, to lower your out-of-pocket premium costs. And those have helped a lot of people. A lot of people are eligible for those and don't realize that they are. People think, you ask some people, and they did statewide, they asked average people, what do you think, if, how much do you think you can make? And a lot of people said, oh, if I make more than $28,000, I wouldn't be eligible. For a family size of one, you're allowed to make $48,000 a year and still be eligible for tax credits to help lower the cost of your insurance. For a family size of four, you can make $98,000 a year. So there are a lot of people who may think that they're not eligible who really are.
So that's something that, as far as the qualifications and new considerations coming down, those are things that people really need to be aware of to make the best choice possible for your family.
Right.
Yeah. Are there any other qualifications that are coming up that are interesting to talk about?
Some of the things that and I'm sorry, I do have to have notes, guys. They have a new cost finder, quick cost and plan finder tool available on Connect for Health website. And it now helps to estimate your prescription costs as part of your out-of-pocket to show you. Because there's a difference between what your deductible is and what your maximum out-of-pocket is. And so this will help you so that you know for sure that your prescription costs are part of that estimated out-of-pocket. And one of the things that I know a lot of people have been scared of is the cost-sharing reductions. Donald Trump did an executive order that said that the government would no longer fund cost-sharing reductions. The Affordable Care Act, as part of it, says that the insurance company has to give cost-sharing reductions. Now, some people don't know, a cost-sharing reduction is a discount that the insurance company gives directly to the patient to lower things like their deductible and their maximum out-of-pocket costs. Now, even though the insurance companies will not be receiving the reimbursement from the government for those, they will still be giving them to the patients. People who purchase their insurance who are eligible for cost-sharing reductions will still get them. And there has been some talk about the increase in premiums, but what I would like everybody to remember, when premiums go up, so do subsidies. We're actually looking at Coloradans paying less money because their subsidies will go up.
And that's something that people need to go into your office to find out if they can make an appointment?
They can make an appointment with me. I'm available Monday through Friday from 8 to 5. They can also go online to Connect for Health Colorado, or connectforhealthco.com, and you can go directly there and purchase your insurance. We're happy to help. There's also 1-800-PLANS-FOR-YOU, which is the customer service phone number. But we are here. I'm here for any of our neighbors. At the clinic, we're happy to help anybody. We're happy to answer any questions that we can. If I don't know the answer, I will find it out.
Well, and that brings me to the next question of the funding cliff. I'm sure a lot of people out there are nervous about what their health care is going to look like and what you hear in the news, and that they're going to fall off the funding cliff. And that's the CHIME Act and the Dear Colleague letter, letter from the House and the Senate. Tell us a little bit about what you can expect in the next few months and how that affects us here in Colorado, and particularly Dove Creek.
Okay. The health center funding cliff was a set time that said Congress needed to ratify funding for federally qualified health centers like ours here, or the money would go away. Now, we were fortunate here that we got our funding early, and so we're fine until May 31st of next year. But many people, many small clinics like ours that are so important to our communities, I mean, it is so important to have a local community clinic. They are losing their funding now because Congress has not signed the CHIME Act. They have not signed this bipartisan colleague letter to make sure that that they stand up and say, we want our clinics. We want you to fund our clinics. And so we are encouraging people, please contact your congressman, contact Congressman Tipton, contact Senator Gardner and Senator Bennett, and ask them to please vote for these things. Get the funding cliff taken care of so that areas like ours do not lose our clinics. And along with that is the CHP, the Child Health Plan Plus funding. The funding for Child Health Plan Plus was cut off September 31st of this year. Now, Colorado has been lucky because we can actually afford to fund ours until January 2018. A lot of states could not, and their CHP Plus programs have ended. If we lose CHP Plus, 75,000 children in Colorado will lose their health coverage. Now, Congress can choose to fix this at any time. So just ask them to please refund CHP Plus so that we can get our children covered.
Definitely, we will be having on the DCTV has the News at Noon program has a Facebook page, DCTV News at Noon, and I'll be putting a little bit of information about the CHIME Act and just a reminder of who your different representatives are, Tipton, Bennett, and Gardner, and how to be able to get in touch with them. And then also the CHP for the kids program, what you can do for that. That brings us to the next point we discussed a little bit ago, which before the show, is that the kids coverage is looking for, all kids coverage is looking for stories.
Yeah, all kids covered.
All kids covered.
Allkidscovered.org. And anyone who has been affected, whose child is on CHP Plus, who will be affected if this goes away, we encourage you, please go on, tell your story so that they can tell these stories to Congress. Because if you have a person and you're telling a person's story and you can say, Amber from Dove Creek says this is going to affect her child this way, instead of going to your congressman and saying 75,000 children are going to be affected, it really does. That human element really makes it easier for our advocates to go to Congress and to go to the Senate and to help take care of this.
Sure, and you can do it's easier than ever to do a little video.
Yeah.
Pictures tell 1,000 words, as I say, so that would be something that also, if you have a situation that might help convince the other elements that be to make the decision and make it quick, that would be a good idea. And speaking of the local, did you have something more to say on that?
No.
No, okay.
No.
We do have a new doctor coming to our clinic. Can
We
you tell
do.
us a little bit about that? And then
Dr. Justin Posner is going to become our new medical director starting January 3rd. He's going to hopefully hit the ground running, and he will be seeing patients 3 days a week. We also do still have Sean Palmer, who is our PA, and he sees patients 4 days a week. So we will be able to have a provider every day in the clinic. We are already starting to take some new patients. I know that it has seemed like we haven't been able to, and it's been hard for people to get in, but we are working on that. We are starting to take new patients only from Dolores County. We want to get our local people back in to our local clinic.
that's important. And we were talking about how to attract doctors and keep them here. And that's something that the community can maybe, going forward, look to extend the hand the other way as well, as far as welcoming the new doctors to want to stay. Because you had talked about some of the newer, younger doctors that do a 2-year program. Tell us what that means.
When a provider finishes school, they can come and do a 2-year rural rotation at a clinic like ours, and they can get their loans forgiven. So what you really need to look at is, how do we keep them here after those 2 years are up? It's difficult, I think, especially with the younger doctors, because there really isn't a lot here. We've had a lot better luck with outdoorsy doctors. If we have providers who come in who are outdoorsy, there's more stuff for them to do here than those who are looking for some kind of a city life.
Right.
Some of the older providers, it makes it nicer because they've done the city, they've done all that. Now they're ready for a little more relaxation, a little more country. And I think that if we can get the clinic involved in the community and get our providers to join that, then I think that we can start to keep providers longer. And Link Pearson, our new executive director, he's very about the mission of bringing the clinic back to the community.
I think that's very important. I'm also the manager for the Chamber of Commerce here, which is growing and coming up, and there have been Colorado State health entities that have joined the Chamber wanting to try and extend that outreach of the Chamber is a good way to connect with a lot of people, not only the businesses, but just also on the community level. And so I'm hoping that that will also help to kind of have a synergy, and we all get moving together and make it a really great place to be. And it is a live show right now, so if you do want to call in with a question for Amber, it's 677-4119, and we'd be glad to take your call. Are there any other issues that really need to be addressed for moving forward for health in our community?
Well, what everybody needs to realize is the Affordable Care Act is still the law. The penalties are still in effect, and as of now, everybody just still needs to have health coverage, not just because it's the law. Now I've got to try to remember. In 2004, there were 180,000 bankruptcies in Colorado because of medical bills. Last year, there were 40,000. So it really is an improvement. And we have seen so many people whose lives have been completely changed by being able to get in and see providers and get the help that they need. So, we really do just please come in, see if we can get help for you. We're here to help. We have programs, and we do not want anyone to not come see us because they don't have money. We have federal programs available. We have state programs available to help people who can't afford insurance. We're always willing to work with any of our patients to make sure better health outcomes, healthier communities, healthier families, healthier Colorado. That is what we are looking for. We talked about the cost sharing.
Is there catastrophic coverage? Is that something?
There is. Catastrophic coverage is available for young adults under the age of 30. And those plans, unfortunately, you can't use tax credits to purchase those plans, but they are a lower cost plan. And also, I don't know if people know, you can keep your kids on your insurance until they turn 26. Even if they're married,
Wow.
They can still stay on there.
That can help a lot.
Yeah.
So, well, I think we hit the tips of the icebergs here as far as the different elements that you want to make yourself aware of and get some more information about. Even if you have a plan, as you said, check out alternatives, because there might be something that might lessen your out-of-pocket expenses. And of course, in our community, as a lot of it is a senior population, prescription drugs and the donut hole, is that what we
Yeah,
call
the
it?
donut hole.
Okay,
Yeah.
Part D is very important to many people, but you need to understand if it works for you, or if you don't have that many prescriptions, then maybe that's not the way to go. So
And there are programs available too for low-income seniors that will help them get assistance paying for their Part D coverage, for their Part B premiums that they have to pay every month, and even some for their Part A and B deductibles. And those are income-based programs, and we will be talking about those as well. We'll also be talking about the Medicaid buy-in program. The Medicaid buy-in program is a program that is available to working disabled adults and children. If you have a disability, if you are on disability and you have a job, you can keep your full Medicaid benefits, even if you have Medicare, even if you're over income, for a very small premium cost. And those are income based as well. And it is actually a really good program. It keeps you with your full Medicaid benefits, which means that you still can go see your eye doctor. You can still go see the dentist and have those be covered, where the Medicare doesn't cover some of those things unless you can afford a supplemental for those as well. And there's changes coming with some of the supplementals. Nita is the supplemental queen. She's going to talk about that stuff when we're at there. Once again, I do encourage everybody, please come to the town hall meeting. Come ask your questions. We'll be happy to answer them. I'll have a sign-up sheet there so that people can make appointments with me not at the meeting, but at the meeting they'll be able to sign up for appointments for me. And we'll go over all the things, any questions that people have, what's coming down the line, and how we are going to be affected here in Dove Creek specifically. It has been one of the biggest things that we have fought against when we go to our trainings is nobody knows who we are, where we are, and if you're not Denver.
Yeah.
So we really wanted to get some answers that were Dove Creek specific.
Well, that sounds like a very important save the date note. Again, it's the 1st from 5 to 7 p.m. at the community center. And again, thank you, Amber, for an inside look into our complex healthcare options. The community is invited. It's at the community center November 1st from 5 to 7, and listen to the panel of experts, ask your questions, and then sign up for an appointment, because it sounds like it's a very individualized thing, so you need to really just go through what your specific situation is.
Right.
So, well, thank you, our viewers, for watching. This has been Talk Tuesday, a production of DCTV in association with the Southwest TV Translator Association and Dolores County Broadcasting. That's it for tonight. Be sure to check out DCTV News at Noon on Facebook for more community information. I'm Kendra Cook. Have a good night.